Anxiously awaiting today's briefing. As we have said previously, this morning we are addressing our current alert level for the province of Newfoundland and Labrador. And I'm happy to share that 70%. Good morning, everyone. Thank you for joining us. Have now had. I have no doubt that many of you have been anxiously awaiting today's briefing. Thank you all for stepping up and doing your part. As we have said previously, this morning we are addressing our current alert level for the province. And I'm happy to share over the age of 70 who are boosted of those eligible have now had their booster dose. That is stat alone should be encouraged. Thank you all for stepping up and doing your part. With our outstanding vaccination numbers and the current COVID-19 who are boosted can avoid hospitalization. That stat alone should be encouragement enough. With our outstanding vaccination numbers and the current COVID-19 situation in the province, Dr. Fitzgerald and her team in public health will be adjusting the alert level to move to a modified alert level 3. That means that come Monday, we will be able to open up a little bit more, from businesses to simply being able to see some more family and friends. In addition, the isolation requirements for travelers into our province is lifting as well. Starting this weekend, people simply need to use the rapid tests provided. No isolation time. And I'm happy to have more good news to share this morning. Our government recognizes the toll that this pandemic is taking on everyone, and particularly artists and the hospitality and tourism industry. You are part of the fabric that makes Newfoundland and Labrador so special, a destination for people around the world. So I'm pleased to announce today more than $9 million in funding for the Tourism and Hospitality Support Program and the Artist Support Program. My friends, things are cautiously moving in a positive direction. Infection rates and number of cases in the province have both been steadily trending downwards. We are in our second week of schools being back in the classroom for learning. Parents and teachers have been giving it their all, and the attendance rate is consistently over 80%. As with easing of the previous restrictions, we've gotten to this point today because the people of this province have been following public health guidelines. Your sacrifice and dedication to follow those guidelines deserve a standing ovation. With our Canada leading vaccination and booster rates, you have trusted the science and put the greater good of the community first. I know you are all tired of sacrifices. We all are. And as we have seen in the last week, there are a few out there who believe freedom is identified and defined by what they are unwilling to tolerate. As if masks, vaccines, and health mandates were fences built to restrict them, rather than the very tools used to protect them and give them freedom. To protect the vulnerable, the elderly, everyone, to help us all get through this. I understand that frustration breeds anger, and I think that's actually normal. I think we've all experienced anger throughout this pandemic. We've all sacrificed so much for so long. But it is in the best and safest way to move forward by respecting the science. Together, we've spent the last 2 years proving that as a province. Finally, unfortunately, I want to convey all of our sincere condolences to the families of those who have passed this last week due to COVID-19. Please know that we are thinking of you, and together we feel the weight of your heavy hearts. I'll now turn things over to Dr. Fitzgerald for today's update and an update on the levels. Dr. Fitzgerald.
Thank you, Premier. Good afternoon, good morning, everyone. Force a habit. So there are 20 people hospitalized due to COVID-19 severity. There have been 372 new recoveries, leaving 1,720 active cases in the province. Since the update yesterday, we're reporting 198 new confirmed cases of COVID-19 in the province. 108 are in Eastern, 42 are in Central, 41 are in Western, and 7 are in Labrador-Grenville Health. 1,235 tests were completed since yesterday, with over 485,000 tests completed to date. We are also reporting 1 new death today in Eastern Health, and we send our condolences out to the loved ones of this individual, as well as to those whose loved ones have passed this week due to COVID-19. Our provincial epidemiology closely mirrors what we are seeing in the rest of Canada. The 7-day rolling average of lab-confirmed cases are trending downward, while the number of people in hospital due to COVID severity remains stable. As the Premier indicated, we will start to gradually ease some restrictions, starting with travel, and effective at 12:01 a.m. Saturday, February 5th, there will be no isolation for fully vaccinated travelers. However, they will be required to take one rapid test each day for 5 days. And effective 12:01 a.m. Monday, February 7th, the province will be moving into a modified alert level 3. Gyms and fitness facilities can expand to 50% capacity. Restaurants are at 50% capacity with a maximum table size of 10 people and physical distancing between tables. Bars can reopen at 50% capacity. However, eating and drinking is only permitted while seated, and masks may only be removed when eating or drinking and while seated. Dance floors will not be permitted at this time. Cinemas, performance spaces, and bingo halls can open at 50 people or 25% capacity per room, whichever is less. Masks must be worn at all times, removing it only to eat or drink where permitted. Arts groups, classes, and amateur sports and recreation teams can practice and train within the group or team without the requirement to physically distance at all times. Competition between different teams is not permitted at this time. Formal gatherings are limited to 50 people or 25% capacity of the room, whichever is less, and informal gatherings are limited to your household's steady 20, your 20 close, consistent contacts. Please do not bring together people who are not in one another's close, consistent contacts. Gatherings in the home are among the highest risk settings for transmission. People are often in close proximity, not wearing masks, and often eating from communal food bowls. We also know that the virus can be transmitted just before a person starts to experience symptoms. With just over a week into school reopening, we have not seen any significant impacts on our daily reported cases or hospitalizations. It is still early, and we continue to monitor this closely. We are working on a solution to allow those that had a positive rapid test in the past 10 days to voluntarily report their result. We hope to have more information to share about this in the near future. We have also updated our close contact flow chart with a new graphic to help people with COVID-19 determine who their close contacts are. And if you have been notified that you or your child is a close contact of someone with COVID-19, please refer to this flow chart to determine what your isolation requirements are, if any. As a reminder, the only close contacts eligible for PCR testing are those who are fully vaccinated, without symptoms, and non-household contacts, as well as any close contact who works in or attends a high-risk setting. Additionally, we have updated our symptom list to remove red or purple spots on the hands or feet. This is a symptom that generally happens later in the disease and when the person is no longer infectious, and we see it more often in children. Children that have passed the recovery period with improving symptoms and no fever do not have to isolate if they have these spots. They are not contagious. I know there are lots of details when we make changes to restrictions, and it's difficult to catch everything. So if you're looking for this information, please visit the provincial government's COVID-19 website. Please do not call 811 for clarification unless you have a medical concern and you need the advice of a registered nurse. There are many families in our province with loved ones that are more vulnerable to COVID-19. For them, the impact of public health restrictions are very real. For others, I know it may be difficult to see the benefit of the restrictions, but they are in place for all of us. Hospital capacity must be available for more than just COVID. Every day, there are unexpected emergencies. No one wants to think about such an event may touch their lives, but everyone in our province relies on healthcare to be there when we need it. So we need to protect that capacity for everyone. Over the next 2 weeks, we will be closely monitoring several key indicators, including hospitalizations, our epidemiology, and the uptake of second doses for children and booster doses for older adults. We are doing very well with vaccinations for children. We are approaching 80% with the first dose and almost 22% with the second dose. We want the vaccination rate for those children to be as robust as it is for adults. and we strongly encourage parents to make the choice to have their child vaccinated. We are also seeing a bit of a plateau in our booster dose uptake, and we really need to get these rates higher, particularly for those over the age of 50. The evidence is clear at this point that being vaccinated with 2 doses reduces the risk of severe disease and hospitalization over being unvaccinated, and having a booster dose reduces that risk even further. The risk for severe disease and hospitalization also increases with age, with 50 being the age when that risk starts to climb. So if you are over 50, like me, please get boosted when you are eligible. The evidence is also clear that a booster dose will reduce transmission of the virus in the community, especially in those first 8 to 10 weeks after you get it. This is still very important, as it helps to reduce spread and give our communities time to reopen and our school-age children to get fully vaccinated. I have often asked you to be kind, and right now, the kindest thing you can do for all of those around you is to get that booster dose. If all goes well, we will ease restrictions further on February 21st. We need everyone to stay with us while we gradually open the tap and monitor the effect. If cooperation wanes now, the impacts could result in a delay. We are all tired of this pandemic and the restrictions, and I can relate, believe me, but we need to pace ourselves. The last thing anyone wants is to have a setback in the final mile because we move too fast. We all want to get back to doing the things we love, and listening to public health guidance is the fastest way to get there. So hold fast, Newfoundland and Labrador, and please stay safe.
Well, thank you, Dr. Fitzgerald. I'll now invite Minister Haggie for some brief remarks. Dr. Haggie.
Thank you, Premier. I'll cover a few areas. I think it's really encouraging to see the change in alert levels today as we take another step towards living with COVID. We've learned a great deal about this virus over the last couple of years. Our vaccination rates have been stellar and are our best safeguard going forward to be able to continue to make further changes. With the change in alert levels, as well as the recent recovery of systems following the cyber attack, I'm very pleased that important healthcare services continue to resume at the regional health authorities. One such important one is cataract surgery, and it's been brought to my attention that there have been some concerns about the number of surgeries being performed, particularly on the West Coast. I want to assure residents that these surgeries are being performed, and there is no cap on eye surgeries at any facility in the regional health authorities. With specific reference to Western, I'd just like to state that they are, however, investigating what local factors may have impacted on the delivery of services. But I'd like to take this opportunity to thank the regional health authorities for walking that very difficult line between the demands of COVID and the need to deliver healthcare services to people who cannot wait. NL VaxPass saw some alterations this last week. Those people who have a valid MCP number and have received an approved medical exemption for COVID-19 can download a QR code to their VaxPass. Those who have an approved medical exemption but no valid MCP can still use the paper documentation. The QR code in these circumstances is currently only valid in this province. For travellers, however, the QR code app has now been improved to add the federal proof of vaccination, and you can use that now instead of the PDF that was required before. For those updates to work, you need to update the app. If you don't do that automatically, you'll have to do it manually, and there's a handy guide on the Living with COVID tab on the website. This time, boosters are not required to be considered fully vaccinated. Until that changes, your vaccination status will remain green with or without your booster. If you wish to update your VaxPass to reflect the booster, simply follow the instructions on that same website and add your new vaccination record. If this is accurate, then you can delete the old one. For some, the booster dose may not yet be available electronically. We do have a backlog of data entry, as over Christmas particularly and into the early part of New Year, a lot of these records were done on paper because of some challenges around IT at the time. We are working our way through that, and we should have that completed and that backlog managed by the end of February. There has been concern about system capacity, with healthcare workers having to isolate. That number is static currently at 734 individuals, some of whom are working whilst isolating outside work hours. 219 of those people are actually isolating because they have COVID themselves. Paxlovid, the antiviral treatment aimed at reducing the rates of hospitalisation, is available in the province, and I can inform listeners that we've actually issued 3 treatment courses so far to date, 1 in Labrador-Grenville and 2 in Eastern Health. It has to be early in the evolution of the disease. You have to have tested positive with PCR or rapid antigen and meet certain other criteria that your physician or nurse practitioner will know about. It is, however, a medication that is associated with significant and severe drug interactions with some common medications, so it may not be suitable for everybody. I think I'd just clue up, Premier, by repeating what Dr. Fitzgerald said. Our best defence, and the reason we are in the good position we're in at the moment, has been the uptake of vaccines. So if you haven't been fully vaccinated, get your second shot when you're eligible, and if you have, get your booster. Stay safe. Thank you, Premier.
Well, thank you, Minister. We'll now invite questions from the media.
Thank you, Premier. Today we have 8 reporters joining us. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. There will then be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions today are from Peter Cowan of the CBC. Peter, please go ahead.
Question for Dr. Fitzgerald. You know, we're seeing quite high numbers of deaths this month because of COVID-19. 4 deaths, for example, reported yesterday. What do you say to people who are really nervous about continuing to open up is going to mean more cases, and especially that they or their loved ones who might have underlying health conditions may mean that it's more likely they contract COVID and end up being one of those people who pass away?
So thanks, Peter. You know, I think what we have to remember is that we aren't going to be able to stop Omicron, especially from spreading. That's going to happen just given the nature of the virus, and we've talked about that before. So we are going to continue to see cases, and you know, getting back to 0 like we have done previously is just, it's not an expectation that we can meet at this point. It's just the virus doesn't, you know, its behavior doesn't allow us to do that. So we have to remember that first and foremost. And then we have to remember that we have the tools to be able to protect ourselves. So getting vaccinated, getting boosted, those are all very important. We know keeping our contacts low, making sure that you know, keep your hands clean, wear your mask. All of those things can help to reduce the spread, and that's certainly you know, as we start to see as we start to move through this, you know, we will get to a point where the prevalence will be lower, and we may see that it becomes a seasonal type of disease. It's hard to know just yet exactly how things are going to go, but, you know, we'll have to treat this in a way that we treat many other respiratory viruses that circulate in our communities every year, and so we all have the tools to be able to do that. We've learned them very well throughout the pandemic. And so, you know, I think we need to hold on to all of those things to reduce our risks as much as we can.
You mentioned that after the first week of school, we haven't seen an uptick in laboratory-confirmed cases. Considering students have all been given rapid tests, how concerned are you about not having that complete picture? You know, we don't know, for example, did 5,000 students test positive on these rapid tests because they don't have to be reported anywhere?
So we know that, our absentee rates certainly wouldn't imply that they're 5,000, but we certainly are working on having that picture. So we are working on a way that people can report those tests. It's just going to take a little bit of time for us to sort through that. So we will have a way to monitor that going forward.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi, thank you. My first question is for Dr. Fitzgerald, and that's you mentioned that we've reached a bit of a plateau in getting boosters out. Why do you think we're in that plateau right now?
That's a good question. I think there's a lot of reasons. I think people perhaps there was some thought that. People weren't at as high a risk, that this was a milder disease, but, we do know that we want to reduce transmission as much as possible. And so we still encourage people to get that booster because we do know that it can reduce transmission and it can reduce severe disease. So it is really important to remember that. And I think there are also people who have gotten infected, and so they're wondering when, do I need to get a booster? And we certainly know that the booster can still give protection beyond what the infection can. So, once you're feeling better, it's certainly safe to get that booster dose. So, I'm sure there are many varied reasons, and we haven't delved into them completely, but I hope that people will start to realize now that the boosters really do make a difference.
Thank you. And Dr. Proton Raman's data predicted a peak of 20 to 30 people in hospital in this wave of COVID. Do those projections still hold up, or is the province expecting to see more people in hospital?
I think at this point we're still maintaining that that's where we will be. As we gradually open up, then we'll see what the effect of that has on cases and on hospitalizations, but it is going to take a bit of time to see that effect, and so it's difficult for a model to to predict completely when you don't have anything to go by, right? So you got to have cases first in order to be able to predict future. So, but certainly it's holding true for now.
Yeah, certainly, Ben, we haven't seen any massive deviation from the original modeling presented a couple of weeks ago, I think is safe to say. And given that we have open schools, I think that's a very positive finding to date anyway.
Our next questions are from Richard Duggan with VOCM. Richard, please go ahead.
Minister Haggie, in your comments a few moments ago, you mentioned that there have been 3 courses of the antiviral pill given so far in the province. What have the outcomes been like thus far with those? Is the treatment doing what we want it to do? And have there been any adverse reactions to it?
Certainly, those are important questions. We have not been advised of any adverse reactions to the treatment. I think in terms of whether or not it's worked, with 3 courses given, it's a little difficult to draw any real conclusions. Certainly, I don't have any further data other than simply the number, but we will go back and see if it's possible to assess that. It is a course of treatment that lasts for several days, so again, in the case of the most recent one, that course would not have been completed yet.
And this is a question that was submitted to me regarding daycares. We've been hearing over the last month of daycares having to close repeatedly due to COVID exposures, which is requiring children to isolate for 10 days. And some parents are raising concerns because after multiple exposures, this is resulting in what they're saying is constant isolation, while schools have basically done away with contact tracing. So, Dr. Fitzgerald, are you considering or would you consider changes to isolation requirements so daycares wouldn't have to shut down every time there's an exposure?
Yeah, thanks. So we've heard those same concerns as well, and our team is looking at that right now and just seeing how we can try to keep the risk as low as possible while preventing that disruption as much as possible. And it is a very delicate balance. Daycares are a little bit different than schools because, you know, we have children there who are not vaccinated and have not had the opportunity to be vaccinated, and generally speaking are not wearing masks through the day. So it is a bit of a different situation and not really fair to compare the two, you know, schools and daycares directly. But we are looking at that and trying to see how we can improve that situation going forward.
Thank you.
Our next questions are from Ronelle Legros with All Newfoundland Labrador. Please go ahead.
Good morning. My question is for Premier Furey. Premier, I'm wondering if you could offer some more specifics on the $9 million support programs for artists and those in the hospitality and tourism industry. How do you plan to roll these out?
Sure. Minister Crocker will be giving more details in the coming day or days. But essentially, there's two programs: one for the hospitality support industry, which people could avail of up to $15,000, I believe, and for the artist support program, I believe it's up to $3,000. The parameters of which and how they apply will be announced by Minister Crocker tomorrow, I believe.
And Premier, how influential was the 2022 come home year in earmarking this money?
You know, we're very committed to continuing with come home year 2022. It's from the beginning we've said it's about trying to anticipate where the puck is going to be, not where the puck is. And I think we're seeing that we're reopening, and hopefully in plenty of time for what should be an incredible summer. So we want to make sure that we're supporting the tourism and hospitality industry and the hardworking women and men in it as we get ready to emerge from the pandemic into what should be a great summer and come home year 2022. So it certainly did contribute, but we also know that, you know, the people who work in this industry account for almost 9%, I believe, of our employment. And we know that they've gone through a tough time, especially during Christmas, which for some is quite profitable. So we wanted to make sure that they could be there to survive, to reap the benefits of come home year 2022, in addition to surviving forever, of course.
Our next questions are from Andrew Waterman with The Telegram. Please go ahead.
Good morning. Thanks for taking our questions. I believe this will be one for Premier Furey. You said in the past that one of the reasons for the Vax Pass is to motivate people to get vaccinated. You mentioned last week that you were, the government was thinking about possibly adding the booster to the Vax Pass. Yet I've heard from several people who are vaccinated, fully vaccinated, the past week that say they believe it's a step too far and that they will likely not go to any restaurants or places that require this as a requirement. Why are you so positive that the Vax Pass is continuing to motivate people in the way you want it to?
Well, we've seen evidence of it in the past. So, I mean, the Vax Pass is a common instrument across the country. We've seen how rates move across the country, how it does motivate people to make the right decision and get boosted. I mean, especially as Dr. Fitzgerald has said, in people over the age of 50, the evidence is undeniable, whether it's, you know, a 50 times rate of contracting COVID and being hospitalized with COVID compared to unvaccinated. So the vaccines do work, and we are considering all options with respect to the Vax Pass moving forward. Listen, no one wants these Vax Passes. Like, we don't want them. No one wants them, but they are an important instrument at this time to ensure that we get through this wave. And if it alters people's behavior, to ensure that they make the right decision and to get boosted so that we can all live a more free life, I think that's an important instrument that I'm certainly not willing to take off the table at this particular moment in time.
And this would be a question for Minister Haggie. Last summer, between June and September, deaths in the province were consistently higher than what was expected. That's according to a recent report from Statistics Canada. Given that deaths from COVID-19 were low at the time, does the Department of Health know what may have been causing the excess deaths?
In specific for that period yet, no, the analysis of that data has not yet been completed. of interest is that January month this year, compared with last year and compared with 2019, there is no significant difference in mortality rates across those 4 Januaries. And indeed, prior to that data coming out, we had looked for excess deaths in the first and second waves of COVID-19, and as a consequence maybe on impacts on the healthcare system. But we found at that stage, which was I think the end of 2020 or early 21, we had no significant excess deaths there. So it is a blip, and we'll be going back to do the due diligence on that. I think it's worth pointing out here that the people who would be doing that analysis, 85% of their regular daily work is in actual fact managing the pandemic. So those kind of activities, while important, have been slowed down as we negotiate Omicron particularly.
Our next questions are from Jamie White with the Appalachian newspaper. Jamie, please go ahead.
Thank you. My first question is for Minister Haggie. Currently, in order for someone to be considered to be fully vaccinated with the VaxPass, they need 2 vaccinations. With all the booster shots rolling out, is that going to change to people needing 3 shots to be considered fully vaccinated?
That is, again, something we consider. Dr. Fitzgerald and a public health team have made recommendations to us based on NACI guidelines. The Premier just a few moments ago referenced the importance of VaxPass and the proof of vaccine as a way of helping encourage people to do the responsible thing from a public health perspective, and it has worked. We saw a significant bump in our second doses and first doses, particularly in younger folk, when that was introduced and warning given that it would happen. If we find ourselves challenged to get boosters, it's certainly another tool in our toolbox, and we'll keep looking at it.
Thank you. And currently with the booster shots, is there a plan to roll out an additional booster shot afterwards, seeing the positives that the current booster shots are having, or is this going to be the final shots that people require?
I think that's $1 million question. I think no one knows the answer to that. Certainly, this virus doesn't exist in isolation in Canada or Newfoundland and Labrador. It exists around the world, and as we've seen, new variants can creep up. And in all likelihood, there will be other variants. So, as Dr. Fitzgerald has suggested, no one has a crystal ball, but in all likelihood, or there's a strong possibility, certainly, that we will require vaccines into the future with respect to COVID variants well into the future.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Thank you. A question for Dr. Haggie to follow up on the question about excess mortality numbers. I looked at the Stats Canada data recently, and for the months August and September in 2020, there were 26 excess deaths, or actual more than expected, and that number became 117 in August and September of 2021. So the question is there something about the way we're counting deaths that we're under-reporting? Because we're only reporting 45 deaths since the beginning of the pandemic.
If the question is around how we report COVID deaths, then I think the answer to that is that we follow national guidelines through Public Health Agency of Canada and that kind of thing. We are reporting deaths where they either died directly because of COVID or COVID was a contributing factor to their terminal or their last illness. In terms of the fluctuations in mortality from all causes, I think 2 things may factor into that. One is we do have an increasingly aging population, and the second thing is that I would refer back to my previous answer, that the people who would be analysing that data and providing advice about particular causes of death have been working at a much slower pace on that, simply because of the demands on the department and the RHAs of managing this wave of COVID. So more to come on that.
Yeah, I would think so. It's all pardon me. It's all kind of unfolding on us as we go forward. The people who are looking at this on behalf of your department, I'd be interested in their reaction to a peer-reviewed article that was published by the Royal Society of Canada in June. The lead author was a woman named Tara Moriarty of the University of Toronto, and her finding was that 2/3 of the deaths outside of long-term care sector may have been missed in the country because of the way we're counting. Are you familiar with that study?
I'm aware that people have been examining mortality, particularly very closely lately. I have to say I'm not yet in possession of an analysis of how that data may or may not apply to us provincially. I do know from clinical experience, both as a surgeon and as a deputy medical examiner, that considerable thought goes into the completion of death certificates for our own vital statistics purposes. All I can say is to repeat the answer that we have not yet been able to complete a fulsome analysis of that, and when that's done, I will have more information for you.
Thank you very much.
Our next questions are from Patrick Butler with Radio Canada. Patrick, please go ahead.
Hi. First question is about the number of people in hospital who have COVID-19. So that total number, I guess including the number that you announced, but also people who would have contracted it since getting in the hospital or who got a positive result after they arrived.
Yeah. So are you asking if the number of people in hospital includes people who have a diagnosis of COVID but are not in hospital because of COVID?
Sorry, let me rephrase this in a clearer way. How many people in hospital right now have COVID-19, not just including those who were admitted because of COVID-19?
Okay. Actually, Minister, you may have that more than I do.
Yes. The last figure I saw was 81. And that's a couple of days old, but we can certainly get you an updated number for today or the most recent time we looked at that. These are manual pulls because of some impacts still on our data reporting systems.
And my second question is about the vaccine mandate. We've seen other provinces abandon their vaccine mandates in the past 2 days. Is that something that you would consider here? Do we have a timeline on something like that?
No, Patrick, I mean, we said from the beginning it was something that we didn't want in place forever, but we still think it's effective right now, and we don't think it's right to remove the mandate just yet. It's proven very effective, and with our high vaccination rates, hopefully the boosters will continue to reflect those rates, and we'll be able to remove it in due time.
I will now go back through each reporter to see if you have one final question. Peter Cowan of the CBC, do you have a final question?
I do, for Dr. Fitzgerald. When you look at the testing numbers, we've been doing somewhere between 800 and 1,500 tests a day. The reported capacity of the lab is around 3,000 tests a day. Why are we not increasing the eligibility for tests in order to use that full capacity in order to get a fuller picture of the COVID levels in our community right now?
So we are still actually testing quite a number of people for COVID. Anyone with symptoms is still able to get a test, and that's different than in a lot of other places. So, we feel we are certainly leaving this open to the greatest degree. We also, we don't need to know about every single case in the community to know how much is circulating. We know that there is an association between hospitalizations and the number of cases, so we can still get a good idea about the amount of COVID that's circulating without knowing every single case. Given that in the past we wanted to know about every case because we were looking at this as a containment. We contact trace to contain the virus. As I've said, we're not in that. We're not in that mode anymore. That's not our management strategy any longer. And so we don't need to know about every case. What we need to know about are those cases that we're knowing about them will make a difference to how we manage them. So if we need it for treatment, if they're working in a in a higher risk setting, and certainly we feel that we're getting we're getting good information about that.
Ben Cleary with NTV, do you have a final question?
I do, thank you. My question is that, I guess for Dr. Fitzgerald, we're seeing tensions rise in Canada and here in Newfoundland and Labrador as people protest COVID restrictions. What's your response to these protests?
I don't know that I have a response to the protests, actually. To be honest, I think, it's a democracy. People are allowed to protest. But, I think we know that restrictions have certainly helped to reduce the spread of this disease, and that has helped significantly with our health system capacity and helped to reduce spread. So, it's I get that everybody is tired and frustrated and everything. We understand that. We're trying to make the best decisions that we can with the information that we have, and that's all we can really do. All any of us can really do. So, I think that hopefully we'll see a change in the tide soon, and we'll be able to live without restrictions at some point.
Thank you.
Richard Duggan with the OCM, do you have a final question?
Yes. Last fall it was announced that mental health exemptions for the vaccine passport were being explored by government. Just wondering if we can get an update on where that stands.
Minister?
The criteria and guidelines for exemptions for COVID-19 vaccine are a clinical standard issue. We have had discussions with the College of Physicians and Surgeons of Newfoundland and Labrador who make recommendations in that regard. They did alter their guidelines slightly, and I could best direct you to them for a more fulsome response. But they lay out the guidelines. It's a clinical standards matter. It is not a government policy.
Renelle Legros with All Newfoundland Labrador, do you have a final question?
Yes, my question is for Dr. Haggie. You mentioned the cyber attack in your opening remarks. I'm wondering if you might have a comment on what sort of impact the ongoing efforts to restore the system may have had on the latest COVID wave. Did that cause any further complications or headaches?
I think that's a perfect opportunity to give a shout out to the staff in IT and the regional health authorities and across the healthcare system in general. They worked very diligently to restore services. And when you compare with other healthcare systems that have been the subject of cyber incidents, our restoration time is actually stunningly short. And I'd like to thank them for that. In terms of the response to COVID as such, I think because of their hard work, we had a significant majority of our systems available or mostly functioning by the time the COVID wave built up. And by then, as I referenced on previous occasions, there are what are called downtime protocols, and they had adapted those to an IT-less environment. And in my earlier remarks, when I talked about a backlog of paper to enter for the vaccine record, that's kind of the tail end of that. So I think the short answer would be we're not aware of any significant impact to our COVID response from the cyber issues.
Andrew Waterman with The Telegram, do you have any final questions?
Yes. I'm not sure who this would be for, perhaps Dr. Fitzgerald or Minister Haggie. I've seen some recently published studies that suggest the COVID-19 vaccine, particularly the second dose, are causing some disruptions in menstrual cycles. I was wondering if one of you could share what you know about the impact of the vaccine on menstrual cycles for anyone in the province who might be concerned about what this means for their health.
I'm sorry, I'm not aware of that, and I don't, I know there was a recent study that sort of looked at that. I just haven't had a chance to look at it. But, you know, most of the side effects with regard to vaccines are temporary and are short-lived. And so we wouldn't anticipate any long-term effects.
Jamie White with the Appalachian newspaper, do you have a final question?
Yes, thank you. This question is for Dr. Fitzgerald. What do you say to those who had difficulties following the frequently changing regulations within modified alert level 4? Now that we're moving to a modified alert level 3, are they going to be more streamlined?
I'm not sure who we're talking about, who's having difficulty following. I'm not quite clear what your question is asking, sorry.
I think they'll be available on the website, hopefully in an easy-to-follow format. But if there are issues, we'll certainly look at communication tools to ensure that look, we appreciate that this is constantly changing and it can get confusing, so we're doing our best to make sure that the communication is clear and concise and easy to follow, and we'll try to do so with this as we go from modified to not modified. I hear your question, I think, but we are working hard to make sure we're communicating that well.
Roger Bill with the Shoreline News, do you have a final question today?
I do, thank you. The Director General of the World Health Organization had some remarks recently that to the executive board, and I just wonder if any of you would disagree with his observation. He said we can neither control nor predict the evolution of the COVID-19 virus, and he warned that it is dangerous to assume that Omicron will be the last variant, or that we are in the end game.
Well, certainly, Roger, I think you've heard us all say something similar on this panel at one point in time over the last almost 2 years. Even today, I suggested that we're going to have COVID-19. It's going to evolve. That's biology. That's virology. It's going to evolve over time. If you look at previous pandemics and how they've evolved into influenza, I think my personal opinion is that's probably where we're headed with COVID-19, and we can expect annual vaccines. Of course, there is the possibility that this mutates to be a less virulent and less severe variant that no one needs to be vaccinated. But if you look at the history of how viruses evolved in the past, certainly it wouldn't be out of the realm of possibility to have. It certainly is likely that we're going to have an annual vaccine for some time. If you look at influenza, and the way that works is the vaccines are created based on historic data. We just don't have any historic data here for COVID-19, and that's why every new variant is so alarming to people, not just in our province, but around the world. But we do need to, and that is part of living with COVID-19 as we transition to a more predictable stage.
Thank you.
Patrick Butler with Radio Canada, do you have a final question?
Yeah, I do. Just on this new initiative to voluntarily report rapid test results, just curious about the timing. Why do we want to do this now, and what do you hope this brings?
So the timing, it's partly because of the new treatment that's available. So we want people to be able to have a way to report rapid tests so that they can, that may be a way to help access treatment. We're working on those mechanisms right now, and we also want to we would like to keep track of positive tests and see that it's an important part of surveillance. So we want to be able to have that going forward throughout the rest of or at least the immediate rest of school year, and we know that other people are getting getting rapid tests done in different work-related programs and travel tests and that sort of thing. So it's just another tool that we have for surveillance, as well as our PCR testing and monitoring outbreaks and that sort of thing.
Thank you, everyone. Premier, do you have any final comments for today?
Sure. Just to pick up on Patrick's last question, though, I mean, this will be a tool going forward as well, and one that we can avail of if, to pick up on Roger's question, if things change in the future, that this will be a piece of infrastructure that will be built in that we can use in the future. So thanks all for joining us today. We know we're not out of the woods yet, but we are getting there with respect to Omicron. So please keep following public health guidelines and do your part and get your jab, your booster, please. Stay safe and please be kind to each other. And I'd like to finally thank Chief Hart and Mary Pia for sending Dr. Fitzgerald and myself a gift. But the real gift was both of you participating in the vaccine clinic in Sheshatshiu. So thank you very much.
Thank you, Premier. Thank you, everyone, for joining us today. Please stay safe and enjoy the rest of your day.
Due to the length of the preceding program, we now join the regularly scheduled program already in progress.
Bring a load in tomorrow, but if they can't work in their profession, that's not meeting the need. So I'm working cooperatively and collegially with associations, with others. We actually put out a pilot program. We just announced a program just a week ago, called for proposals, and we're targeting in particular professional associations, licensing bodies. We're providing financial resources so that they can prove out that these credentials are workable in our province. And so we're doing everything we can to meet that challenge. But again, it's not totally in our control.
Fantastic. Well, you know what? I knew when we started this conversation that it could easily be an hour, but we've got 2 minutes left. And you know what? I really wanted you to talk about the skills for the future. I mean, we have Memorial University of Newfoundland and Labrador. We have the College of the North Atlantic. I mean, our post-secondary system is, equal to none. But you know what? At the same time, I mean, we've got a plan for the jobs of the day today and the jobs of tomorrow. And that falls within your mandate as well.
It does. So we spend about roughly just over $150 million a year skilling up Newfoundlanders and Labradorians.
Yes.
So I want to make that, we could close off by a truth, which is that any Newfoundlander and Labradorian who needs to skill up sees that they may be a little bit vulnerable in the labor market. They don't know if if their skills are going to meet the future. We can skill them up, and we prioritize that. Every job that should be filled, we offer obviously first to a Newfoundlander and Labradorian, and then reach out. We invest $150 million a year in new skills. But we're doing things like, for example, not too long ago, we announced a new program at the College of the North Atlantic for electric vehicle maintenance. You know what? You got to forecast this. You got to predict this. You got to understand it. And that's where my head is.
Well, Jerry Byrne, it is always a pleasure. I'm sure that we'll have you back on Out of the Fog in the future. But you know what? Thank you so much for all the service that you have given and the work that you do every day.
I love the energy of the conversation. Thank you, Lynn, so much. Thank you.
And we'll be back after these messages.
It all started when I racked up some serious debt. Interest payments were going up, creditors were calling. Janes and Noseworthy came up with a plan. Knowing that the phone was going to stop ringing and that I was not in this alone was a huge relief. Bankruptcy or a consumer proposal or whatever help you get is not the end. It's just the beginning. A chance to start again with knowledge and support and people in your corner. Are you ready? Get out of debt. It's okay.
Learn more about Leah's story at janesnoseworthy.ca.
And he fell. Whoa, I'm not driving. I'm way too stoned. How are you feeling, Veer?
Oh, since we had that talk, I'm not driving tonight at all.
What about you, Dave?
You only had a couple of drinks.
And only a couple of puffs.
I don't drink and drive. No way I'm getting behind the wheel when I smoked weed, too.
How are we getting home, then?
Well, you can drive, Dave.
Come on, Dave.
Take one for the team, buddy.
Don't let weed and alcohol influence your decision to drive.
Yeah, I need a ride.
If you have a comment about this program, we'd love to hear it. Email or call us or send us your feedback through social media.
What a pleasure it was to have Jerry Byrne on the show tonight. Join us next time on Out of the Fog.
have a comment about this program, we'd love to hear it. Email or call us, or send us your feedback through social media.
Hi, I'm Carl Wells, getting ready to record another edition of Carl Wells Point to Point. It's a program where I chat with members of our community, and they talk candidly about their lives and careers, from their earliest dreams to their greatest triumphs. I think you'll find it informative and entertaining. Please join us for Carl Wells Point to Point, right here on Rogers TV.
Welcome to the traditional, ancestral, unceded territory of the Stalo people. The Stalo are people of the river. I'm so thankful for the courage and resiliency of our ancestors who lived on this land since time immemorial. Each of us have gifts from the Creator, and our Creator has a plan and purpose to be fulfilled in our territory. As we embrace our traditional teachings, we can lead the next generation into the fullness of what our Creator designed. Our shared history reveals a broken relationship, but as all Canadians commit to hear truth, acknowledge injustice, we can learn to walk in our traditional way, Letsamot, with a good heart and a good mind. Then all of our lives will be enriched. Kwasai.
You're watching Rogers TV St. John's.